Hello everyone and welcome back to my playlist of medicine which we are doing from Davidson textbook of clinical medicine 24th edition है and endocrine disorders में thyroid आज continue करेंगे autoimmune thyroid diseases. The thyroid diseases are amongst the most prevalent antibody mediated autoimmune diseases and are associated with other organ specific autoimmunity. So that's an important initiating paragraph जिसमें बता रहे हैं कि basically thyroid autoimmune disorders are pretty common and they are also associated with other disorders, okay, other autoimmune disorders somewhere else in the body. So if you encounter a patient with thyroid autoimmune disorder, always think about other autoimmune problems in the body as well. Autoantibodies may produce inflammation and destruction of thyroid tissue, and that leads to hypothyroidism. Obviously, when the thyroid tissue will be destroyed, it will be functioning less than the normal, and it will be enlarged, so goiter, and such situation is known as Hashimoto thyroiditis, or sometimes even transient thyrotoxicosis. So sometimes it actually works more. So the remaining bits of the thyroid gland work super efficient, and this is then known as thyrotoxicosis or Hashitoxicosis because it is hyperthyroidism in the setting of hypothyroidism. Okay. And there may be, stimulating TSH receptor antibodies to cause thyrotoxicosis. So, दो तरह के autoimmune antibodies होंगी. So, suppose this is your thyroid gland. One antibody category will be the one जो पूरे system को suppress करेगी. This will primarily lead to hypothyroidism with maybe some events of hyperthyroidism. And then another category of antibodies which are called stimulating antibodies. They will actually stimulate the receptor, and this will lead to hyperthyroidism. And if this happens, this is known as Graves' disease. तो ये आज का हमारा टॉपिक है. We will talk about the antibodies which actually overstimulate the thyroid receptor, the TSH receptor basically, and the thyroid gland starts working more, and this scenario is called Graves' disease. So Graves' disease occur at any age but is usual before puberty, and so see it's pretty young age before puberty, and most commonly affect women aged 30 to 50 years of age. So female 30 to 50, also before puberty. These are the, age distribution and gender distribution for Graves' disease. The most common manifestation of thyrotoxicosis. So, अब आपको एक general idea है कि what we'll be talking about in Graves' disease is antibodies which are stimulating the TSH receptor. As a result, more and more working in the thyroid gland and more, thyroid hormones leading to thyrotoxicosis. So, the most common manifestation is going to be diffuse goiter. यानी the whole thyroid gland in the neck region is going to be enlarged. Okay. Graves' disease also causes ophthalmopathy, eye में problem, and really Pretibial myxedema. We'll talk about this. These extra thyroidal features usually occur in thyrotoxic patients but can arise in the absence of thyroid dysfunction. So, primarily Graves' disease में there are thyroid problems, which is goiter and thyrotoxicosis, and then there are extra thyroid problems which include eye issues and peritibial myxedema. So let's talk about what happens in Graves' thyrotoxicosis. The pathophysiology is basic idea मैंने आपको दे दिया है. It results from production of antibodies directed against the TSH receptor on thyroid follicular cells, and they stimulate the thyroid hormone production. So you got the basic idea. This is the cell, this is the TSH receptor, and the autoantibodies are stimulating this receptor. As a result of this, the thyroid gland is making more thyroid hormones. These antibodies are termed thyroid stimulating immunoglobulins or TSH receptor autoantibody traps इनको हम कहते हैं. They can be detected in serum of about 80 to 90% of the patients who have Graves' disease. So basically they are the primary culprits. The concentration of the traps in the serum is presumed to fluctuate to account for the natural history of Graves' thyrotoxicosis. कभी antibodies ज़्यादा होती हैं, कभी कम. Thyroid failure seen in some patients may result from presence of blocking antibodies against TSH. So this is a rare phenomena. Usually the antibodies are stimulating antibodies. Sometimes they can also be blocking antibodies. So far so good. Graves' disease has a strong genetic component. That's an important part. There is 50% concordance of thyrotoxicosis between monozygotic twins. So that means if you are monitoring monozygotic twins, there is 50% concordance. So 50% is a very high number for genetic origin of a disease in monozygotic twins, okay? And if you talk about dizygotic, it's still 5%. Genome-wide association studies, जिसमें हम sequencing करते हैं पूरे genome की, they have identified polymorphisms in all these genes associated with Graves' disease. Okay, many of these loci have been implicated in pathogenesis of other autoimmune diseases as well. So these genes are not particularly associated, particularly the major histocompatibility complex, because all your autoimmune system is then controlled through here, CTLA4, all the immune profile. So these are all the autoimmune associated genes, and they are not only disturbed in thyroid autoimmune disorders but also in other autoimmune disorders. Okay. A suggested trigger for the development of thyrotoxicosis in genetically susceptible individual may be infection with the viruses. That's an important point. So the person is born with these, mutations or polymorphisms. They are susceptible to develop thyrotoxicosis because of Graves' disease, and this is, actually exacerbated by viral or bacterial infections, particularly E. coli species, Yersinia, Enterocoletica. These are the ones which actually augment the thyrotoxicosis. Okay, smoking is weakly associated with grave thyrotoxicosis but strongly linked with the development of the ophthalmopathy, and ophthalmopathy is one of the issues associated with Graves. How do you manage these patients? Obviously, think about that there is a state of hyperthyroidism, right? So thyroid functioning more, and therefore there will be symptoms of thyrotoxicosis, and you have to use beta blockade, and we have discussed this previously. Some clinicians adopt an empirical approach prescribing a course of anti-thyroid drug therapy and then recommending radioactive iodine or maybe surgery to block the effects of thyroid hormones. A number of observational studies have linked therapeutic iodine treatment with increased incidence of some malignancies, so some people are cautious about it, But primarily, you have to use beta blockers and anti-thyroid treatment and the other symptomatic stuff, जो thyroid hormone की वजह से होगा. और कौन-कौन सी anti-thyroid drugs हम routinely use कर रहे होते हैं? The most commonly used are carbimazole and its active metabolite, which is known as methimazole. This is, however, not available in particularly in the United Kingdom. Propyl thiouracil is another drug which is equally effective. These drugs reduce the synthesis of new thyroid hormone, and this is what you would want in these patients. Carbimazole also has an immunosuppressive action leading to reduction in the TRAb levels. So now if you know the pathogenesis, then you know actually how to handle the disease. That's easy. Okay. Antithyroid drugs should be introduced at high dosages, and the dosages are written there. Usually this results in subjective improvement very early on. Within 2 weeks, the patient responds. At this point, the dose then can be reduced to maintain आप thyroid function test करवाते रहेंगे, and then you can monitor the dose. Okay, between 50 and 70% of the patients with Graves' disease subsequently relapse. दोबारा होती है disease within usually 2 years. Therefore, you have to continuously monitor them by thyroid function tests. Risk factors for relapse include younger age, male gender, although the disease is more common in female, but if you are a male, the chances for relapse are more than compared to the females. अगर higher TRAb titers हैं at the level of the diagnosis and goiter, तो ये चीजें अगर मौजूद होंगी तो इस स्टार्ट से आपको पता होगा कि ये मेरा वो पेशेंट है जिसमें रिलैप्स के चांसेस ज्यादा हैं. Okay, in these patients, satisfactory control can be achieved by blocking thyroid hormone synthesis with carbimazole, and you can also add levothyroxine to block thyroid functions. Anti-thyroid drugs can have adverse effects. Obviously, like other drugs, they can also have adverse effects, including agranulocytosis. यानी आपके granulocytes are disturbed in the blood, including neutrophils. Patients should have been warned to stop the drug and seek medical advice immediately. अगर sore throat होता है, fever develop होता है, because these are the signs that patient is neutropenic and now the person is developing infection. Propyl thiouracil is associated with a small but definite risk of hepatotoxicity, so liver derangement. LFTs करवाते रहे in patients का. Okay, so that's how you are dealing with the patient of thyroid Graves' disease. Surgery is an option. Patient should be rendered euthyroid with the anti-thyroid drugs before operation. So even if you are planning surgery, first give the anti-thyroid treatment, make them euthyroid. Their TSH and T4 levels should be okay before proceeding to surgery. Oral potassium iodide 3 times a day, 60 milligram, is often added for 10 days before surgery to inhibit thyroid hormone release so that the patient does not enter into any thyroid crisis during surgery. Traditionally, a subtotal thyroidectomy is performed, यानी पूरा thyroid नहीं निकालते. While complications of surgery are rare, and 80% of the patients are euthyroid, 15% are permanently hypothyroid. So that's one of the complication. Obviously, any surgery is not free of complication. You should know that, and hypoparathyroidism is always associated with as a complication with thyroid surgeries. Radioactive iodine has also been administered orally as a single dose and is trapped and organified in thyroid. This I-131 emits both beta and gamma radiation, although it decays within few weeks. It has long-lasting inhibitory effects on survival and replication of the follicular cells. That's what you want. You want to inhibit the follicular cells. The variable radioiodine uptake and radiosensitivity of the gland means the choice of the dose is empirical. So you adjust the dose of I-131 according to the patient. And then if thyrotoxicosis persists after 6 months की treatment के बाद भी a further dose can also be given. So you always have to evaluate your patient. In pregnancy, it may be associated with significant maternal and fetal morbidity. Management is, अभी हम देखते हैं management के बारे में, we'll talk about it. Adolescence में thyrotoxicosis can occasionally occur in adolescence and in almost always due to Graves' disease. The presentation may be atypical and management will have a look in a minute. अब ये पहले इससे पहले कि I start the ophthalmopathy, there is a table which I think is worth going through. Comparison of the treatment of thyrotoxicosis for Graves' disease. So either we have anti-thyroid management pills which will block the thyroid hormone function, either we remove thyroid gland subtotal thyroidectomy or radioactive. And which patients you choose, which type of treatment is written there. So first episode in the patient, less than 40, you start with anti-thyroid. If there is a very large and cosmetically and physical signs and symptoms goiter ke maujood hain, you go for removal of the thyroid gland. And if patients are more than 40 years and there is recurrence, and then you use radioactive iodine. Remember, there are certain contraindications associated to anti-thyroid drugs. Breastfeeding is at the top. Propylthiouracil may be suitable, but other drugs are contraindicated. And previous अगर thyroid surgery हुई है या कोई फॉर एग्जांपल ऐसा बंदा है जिसकी वॉइस पर उसका प्राइमरी प्रोफेशन डिपेंड करता, सिंगर है, ब्लैक स्टार है, तो उसमें you'll be careful for removing thyroid because one of the complication could be damage to the laryngeal apparatus and nerves. Okay, and complications associated with the drugs are all written there as well, so pretty important. Okay, now thyrotoxicosis in adolescence, presentation may present with deterioration in the school performance or symptoms such as, so अक्सर ये इतना वेग होता है deterioration, आप बच्चे को डांट रहे होते हैं कि भाई तू पढ़ सही से नहीं रहा, पता चले उसका थायराइड का इशू था, ठीक है. And anti-thyroid drug therapy prolonged courses may be required because remission rates following an 18-month course are much lower than compared to adults. So इस age group में you have to consider this कि recurrence is common and adherence to the therapy is very important, and usually radioactive iodine should be avoided. This is kept for those who are more than 40 जिनमें recurrence हो रहा है सर्जरी के बाद भी. So that's a small nice box for adolescents, growing बच्चे जो हैं. Now let's have a few minutes spent on the eye issues associated with Graves' disease. The condition is immunologically mediated, but autoantigen have not been identified. But होता ये है within the orbit, आपका जो orbit जिसमें eyes हैं आपकी, the dermis भी जो ऑर्बिट में एसोसिएटेड एरिया है, देयर इज साइटोकाइन मीडिएटेड प्रोलिफरेशन ऑफ फाइब्रोब्लास्ट एंड दे सीक्रेट ग्लाइकोजामाइनोग्लाइकेंस. सो फाइब्रोब्लास्ट यहाँ पे सॉफ्ट टिश्यू में, कनेक्टिव टिश्यू में, दे इंक्रीज इन नंबर एंड दे स्टार्ट इंक्रीजिंग मोर एंड मोर ग्लाइकोजामाइनोग्लाइकेंस. The resulting increase in interstitial fluid content combined with chronic inflammatory cell infiltrate leads to swelling and fibrosis of the extraocular muscles. And then obviously जो पीछे muscles हैं, once they are hypertrophied and they are engorged and they are swollen, then they push the eye forward. There is a high retrobulbar pressure. आंखों के पीछे प्रेशर जो है वो बढ़ गया है. Therefore the eye is displaced forward. आंखें ऐसे बाहर निकल आती हैं, which is what we call exophthalmos and proptosis. And in severe cases there may be even nerve compression. Is there a diagram? This one. You see the eyes are pushed forward because इसके पीछे जो muscles हैं, they are swollen, they are inflammatory, infiltrates है उनके अंदर, fibrotic tissue है, all these sort of things. Okay, so these are all the muscles which are swollen. They are pushing the eye forward. Ophthalmopathy, like thyrotoxicosis, typically follows an episodic course and is helpful to distinguish patients with active inflammation from those in whom inflammation is actually burned out, because ophthalmopathy is a later stage. Eye disease is detectable in up to 50% of thyrotoxic patients. It is more common in cigarette smokers, important point, and exacerbated by poor control of thyroid function, especially hypothyroidism. So, the most frequent presenting symptoms related to increased exposure to the cornea. अब जाहिर है आंख इस तरह बाहर निकलेगी ना तो कॉर्निया में ulcers and all these things and eye pain and conjunctiva, so corneal issue, gritty sensation, ऐसा लगता है मट्टी चली गई आंख में, patient ये complain करता. Right. The majority of the patients require no treatment for this other than reassurance, because when you treat the thyrotoxicosis associated with Graves, these symptoms will be subtle. Smoking cessation is advised, obviously, and there are some obviously treatment to reduce the friction at the corneal level. So methyl cellulose eye drops and gel counters, they always help. Okay. Patients are also advised for tinted glasses and spectacles वगैरह यूज करें ताकि अगर बाहर जा रहे हैं तो मट्टी वगैरह आंखों में ना जाए, lacrimation कम हो, all these sort of thing. In patient with mild Graves ophthalmopathy, oral selenium improves the quality of life. However, these are all conservative type of management. Nothing is definitive for ophthalmopathy. More severe inflammatory episodes are treated with glucocorticoids. Now that's going to be the extreme, where you are actually inhibiting inflammation. There is also an increasing trend to use alternative immunosuppressive therapies such as rituximab and cyclosporine. Not very famous though. Loss of visual acuity is an indication for urgent surgical decompression of the orbit, because now you are talking about compression of the nerve. In burnt out disease, surgery of the extraocular muscles is also sometimes done. Some patients are also very much cautious about their cosmetic appearance, so you may have to consider surgery for such patients. Then we have pretibial myxedema, the infiltrative dermopathy. Now, this is inflammation and infiltration within the skin. Occurs in fewer than 5% of the patients with Graves and has similar pathological features as occur in orbit. यानी inflammatory cells आएंगे, increase fibroblasts, increase cytokines, and as a result of this, what happens? It takes the form of raised pink-colored or purplish plaques on the anterior aspect of the leg, extending from the dorsum of the foot, and this is very very typical of Graves disease. So Graves disease में ये दो आपको signs and symptoms लाजमी पता होने चाहिए. One is in the eye, the other one is in the leg. The lesion may be itchy, खारिश होगी, and skin may have a purely orange appearance. यानी जैसे orange की skin होती है ना, ऐसे dot 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 खड्डे खड्डे छोटे होते हैं, उस तरह की appearance. ये breast cancer में भी होती है by the way, breast में. So leg में अगर हो रही है, so this is peritibial myxedema. Treatment is really required because once you treat the thyrotoxicosis, it gets away, but sometimes you may have to use glucocorticoids to, avoid inflammation. So, pretty simple and straightforward topic, but very important. What is Graves disease? Graves disease is hyperthyroidism because of antibodies which stimulate the TSH receptor. That's all for today's video. Next video में आपसे मुलाकात होगी अगली किसी autoimmune disorder के साथ, and we'll continue the discussion of medicine in thyroid gland. All the very best. Take care of yourself.